Hello everyone, my name is Brandy Williams and today I will be sharing with you information about the Epstein-Barr virus. The Epstein-Barr virus comes from the family of herpes viridae or herpes. The subfamily is gamma herpes viruses and the genus is lymphocryptovirus. The reservoir for Epstein-Barr virus is humans. In fact, it is the most common virus in humans. Approximately 95% of the world's population has an asymptomatic lifelong infection of Epstein-Barr virus. It has the ability to remain latent for years after the initial infection has occurred. And it does this by replicating and surviving in the host B cells, using glycoproteins to enter that cell. It also is able to evade the immune system response by injecting its own DNA into the host cell's nucleus. And it enters the host by infecting the epithelium of the throat and salivary ducts. Diseases related to the Epstein-Barr virus, the most common is infectious mononucleosis, also known as the kissing disease. Epstein-Barr is related to autoimmune diseases and may put these people at a higher risk for developing systemic lupus erythematosus, rheumatoid arthritis, multiple sclerosis, type 1 diabetes, celiac disease, inflammatory bowel disease, and juvenile idiopathic arthritis. Epstein-Barr virus is also related to cancer. It's linked to gastric cancer, lymphoma, nasopharyngeal cancers, and some non-Hodgkin's lymphomas as well. In fact, it contributes to 1.5% of all the cancers worldwide, of all of those cancers worldwide. Signs and symptoms of infectious mononucleosis, which is caused by the Epstein-Barr virus. Fatigue is the most common. Fever, inflamed or sore throat, swollen lymph nodes of the neck, rash, and muscle weakness. Patients can also have chronic symptoms which last much longer than the normal 2 to 6 weeks, and that includes liver dysfunction, enlarged spleen, anemia, an increase in other infectious diseases occurring, and low platelets. Epstein-Barr virus is spread most commonly through bodily fluids, especially saliva, and that occurs when an infected person shares objects such as drinking glasses, toothbrushes, or food with someone who is not infected. Again, kissing a person with an active infection can transfer the virus, and having contact with toys that a child has drooled on. If that child has an active infection, it can be passed on that way. I also read that the virus probably, there wasn't really a lot of information to confirm how long it survives, but it says that it probably survives as long as the item that the child has touched is moist. The virus also can spread through blood and semen during sexual intercourse, blood transfusions, as well as organ transplants. The virus is typically diagnosed with lab tests, blood work. There are several different antigens that can be checked. The first one is the viral capsid antigen, or IgM. It appears early in the infection and would disappear after 4 to 6 weeks. The anti-VCA IgG appears in the acute phase of infection, peaks at 2 to 4 weeks, and then there is a slight decline, but it persists for the rest of the person's life. So you could draw that particular, you could test for that particular lab at any time in their life, and you would get a positive result if they've had exposure or if they've had the virus. The anti-early antigen IgG appears in the acute phase, It's not detectable after 3 to 6 months, and it's usually used as a sign to tell that there's an active infection. The nuclear antigen appears at 2 to 4 months after the onset of symptoms, and it also persists for the rest of the person's life. There's one other test that is generally not used called the monospot test, and is not really used because other diseases can cause this test to be positive. It can also produce false positive and false negative results, and it does not confirm the presence of an EBV infection. Currently, there is no treatment available for the Epstein-Barr virus because it's a virus. If a person has infectious mononucleosis, you can treat them with just managing the symptoms, and that would include over-the-counter medications for fever or pain that might be related to the infection. And usually those symptoms will subside within 2 to 6 weeks. There are other diseases and cancer that are caused by the virus, and the treatments for those vary greatly depending on what the disease process is that's going on. Prevention of infectious mononucleosis caused by the virus would be don't kiss anyone with an active infection, don't share the items I talked about earlier, drinking glasses, straws, toothbrushes, food. Don't share that with a person who does have an active infection. Use protection with intercourse, eat a nutritious diet, plenty of rest, and control stress. There's no vaccine available for the Epstein-Barr virus. The virus is not cleared from the body once the active infection is over. It uses DNA methylation to hide from the immune system. And so that means that a latent infection, or one that's kind of hiding out, it can be reactivated from those latently infected cells, and usually the trigger for this is excessive stress to the body or the immune system. Few interesting things that I learned while researching for this project was that the Epstein-Barr virus was discovered over 50 years ago, and it was the first virus shown to cause cancer in humans. Also, I found it interesting that the Epstein-Barr virus can transform B cells in vitro.